the article I'm talking about concerns the cost of cancer care and what we can do about it.
Okay.
So it's a commentary that identifies some of the reasons why cancer therapy is just so expensive, and provides some suggestions on what we can do about it. So if you look at the cost of healthcare, everyone knows it's skyrocketing and pretty much becoming unsustainable. But that is, if at all it's even more true in something, it's cancer. Cancer care is extraordinarily expensive, particularly with the new drugs coming out. And many of the new drugs will prolong life by a few weeks, a few months, but can be priced in the hundreds of thousands of dollars. So the burden on the healthcare economy of cancer alone is substantial. What we discuss in this article is why is cancer treatment so expensive? And some of the reasons we identify are that it costs a great deal of money to develop a new cancer drug. It has to go through preclinical studies, phase 1, 2, 3. Many drugs don't turn out to work, and so there's a high failure rate. So it costs a lot to develop a drug, absolutely. But there are other factors, and these factors are equally important, if not more important. Unlike many curable conditions, cancer treatment, cancer drugs often represent a monopoly, an unrecognized, subtle monopoly. So for example, if you have a pneumonia and there are 5 antibiotics to treat it, there's a price control offered by the fact that there are 5 antibiotics, recognizing that if you use one and the pneumonia is cured, you won't need the other 4. So every drug competes with each other to make sure that they are used and not the other 4. That's what we do with televisions, phones, whatever. There's a price control offered by the fact that we have a choice. For many incurable cancers, there is no such choice. The choice is actually deceptive. Many cancers are not curable. And if there are 5 drugs to treat an incurable cancer, in general, a patient goes through each one of those 5 before we say that, unfortunately, no other treatment seems to work and call it quits.
Sure.
So a patient actually has to take each of those drugs. It's not a question of which drug to choose. It's only the timing that the physician is deciding. Therefore, each drug actually represents a monopoly without which the patient shouldn't actually go through their cancer therapy. And recognizing that is very critical, because we all know whenever there is a monopoly, the price can be whatever the market can bear. And recognizing that there is a monopoly in play, and the fact that there are 5 or 6 drugs to treat a cancer doesn't mean that there is actual price competition, is very, very important. Other reasons why cancer care is so expensive is that even when a drug goes off patent and becomes generic, the price control that generics bring is often not the case in cancer. For example, if you have a new drug to treat a peptic ulcer and it's priced 100 times more, you generally won't buy it because you can always try the cheaper one. And if it doesn't work, then you can take the expensive one, if at all. On the other hand, with cancer, the new drug comes not with the possibility of improving your stomach pain, but it's going to tell you that I will prolong your survival. Everyone wants the new drug when it's prolonging survival. So the old drug or the generic drug quickly becomes out of fashion, old, and not as good as the current new one. So the new one is always going to enjoy that same monopoly status, even when the generic comes around. And then even generics are expensive. It's not like the generic cancer drugs are cheap like Tylenol. They are $10,000 a year or something like that, sure. Whereas the proprietary one might be $100,000 a year. So there are many reasons, and these are things that we outline in this article. The solutions are all hard. Other countries have gone through this. There's no easy solution to this. What we provide is a list of options for us to consider and debate. One or more of these may be quite helpful in lowering the price of the cost of cancer care. The first proposition is value-based pricing. This is something that other countries do. So for example, if a new drug company comes up with a drug that prolongs survival by, say, 6 months, and say they want to price it at $100,000 per year, it's not going to go anywhere in Canada or the UK. because they have a metric by which they say for every extra year of quality adjusted life, one extra year of good quality life, the cost of the medicine can generally run $20,000, $40,000 a year, but not more than that. They don't have a fixed number, but they have a general number around which they work around. So the companies have to come down to that price, or maybe that drug will not be allowed to be marketed in the country. In the US, on the other hand, the price can be $100,000, it can be $200,000, and there is no body or agency that can tell them what the drug can be priced at. So we really don't have a value-based pricing system. That is why you see drugs which prolong life by 2 weeks or 4 weeks or 1 month be priced at $100,000 per year. This has to change. The second solution we provide is what to do when we identify a monopoly. A monopoly is subtle, as I mentioned, and probably will require a team of experts with no conflict of interest to assess every new drug as it's approved for cancer and determine whether it's going to enter and occupy a monopoly situation. If they determine that something like that is existing, just like we do with any other monopoly, we should have some legally mandated price control, or at least a voluntary system where the drug company, in exchange for some other solution from the FDA, lowers the price or makes a price control that's more reasonable. Or finally, other countries have done what is called compulsory licensing, where if a drug is priced so high that no one can really afford and it's life-saving, then the government can step in 2 years after the drug's been on the market, and after having made a good faith effort with the company to try and resolve the price issue, to issue a license to a generic company to manufacture the drug at lower cost. This is being done it was in the Wall Street Journal last week, in India for a drug called sorafenib, which is used to treat cancer. Brazil has done it for HIV drugs. So this is something that is legally allowed, but it's not something that the US has ever done. Other solutions would be generic companies to step forward and non-profit generic companies to arise. Most generics are also profit-making companies. If we had non-profit organizations, big non-profit organizations, step up and start commercially producing drugs, or even allowing the licensing of drugs made elsewhere, approved by the FDA, that would lower the cost of drugs. And then finally, we need good national healthcare guidelines for treatment of cancer, where there's no incentive to keep giving chemotherapy, but there are guidelines on which drugs to use and what number of drugs to use for a given cancer.